So my name is Julianne Armijo. I'm currently a PhD candidate. I spent most of my teens until my mid-20s very depressed and intermittently suicidal. And then things started to change as I started to notice what I reflected back on as more hypomanic type symptoms. And that progressed until my 30s, where I finally had my first big manic episodes, and I was finally diagnosed with bipolar disorder. I started off with bipolar disorder type 2 when I just kind of had these hypomanic episodes, which converted to bipolar disorder type 1. I went through a bunch of medication trial and error and titrations. And again, I ended up going on bupropion, which inspired a very big psychotic episode that landed me in the hospital. And then finally, after more trial and error and another visit to the hospital, my treatment regimen finally rested on lamotrigine and then some risperidone, an antipsychotic. So going into the ketogenic diet and not really having a whole lot of guidance that was geared towards adults or in a medical type sense. And since my early 20s, I'd been practicing intermittent fasting before there was really a whole lot of research on it. And just kind of these light bulb moments later on, just realizing that this was like my body trying to heal itself. Once I started to get things dialed in, I noticed at first that I was a little worried. I was like, oh my gosh, am I getting hypomanic? I feel so good, and you start to get scared once you start having that recognition. I just felt all of these very positive things, in my body, not feeling necessarily very bloated. Not that I had a whole lot with the medications I was on, just feeling this kind of lightness of being. It's hard to describe. A lightness of being in my body and in my mind, and I guess probably in my spirit as well. Changing to a keto lifestyle has allowed me to come off the medication that's associated with the most side effects and increased morbidity and mortality. It's a holistic way to approach your whole being.